Don't fall.
All right, so we'll just give it a moment and get started as soon as we've got everybody in the room. Okay, well, I think we'll go ahead and get started. Thank you for joining us today. I'm Allison Foster. I'm the president of the National Board of Public Health Examiners, which, as you all know, administers the CPH certification program. We started the CPH book club, I think, about 4 years ago. It's been going for a while. We currently have 1,500 members, and we read between 7 and 8 books a year. So we've read a lot of really great publications, ranging from topics to infectious disease, behavioral economics, policy and public health. So if anybody's on today and you have your CPH and you want to join the book club, then you just go to our website, and we do have a page with instructions how to join the book club. I'm just going to share 2 housekeeping items before I hand it over to my colleague. First, we are recording this session, and we will post a recording shortly. We also are going to be having our usual online discussion about this book that's going to start June 3rd or 4th, whichever that Monday is. So we've got a couple other weeks. So if anybody is on today and hasn't finished the book, you've still got time to finish before we start talking about it online. So Carly Anderson is one of our longtime book club members. She's going to be moderating today's discussion. So we anticipate the webinar probably lasts between, I don't know, maybe around 45 minutes. We'll see. So we should have plenty of questions from the audience. So if you do have questions for the authors, just submit them through the Zoom Q&A, and we'll get to as many as we can. And we are going to keep everybody on mute just so we don't have any background noise, but the Q&A should work well for submitting your questions. So Carly, take it away.
Thank you so much. So yeah, I'm Carly Anderson. I'm super happy that we get to have Celeste and Jane here today to talk about their book, On the Job. So Celeste Monforton is the director of Beyond OSHA Project and a lecturer at Texas State University. And Jane von Bergen is an award-winning reporter who covered labor more than half of her 35 years at the Philadelphia Inquirer. Would you guys like to introduce yourselves briefly more than that? I kind of just gave a Cliff Notes version. Okay, so we'll jump right into the questions. So our first question is, why did you write this book, On the Job?
So I'll take that one. I had an amazing grant from the Public Welfare Foundation, and it was open-ended. The idea was that I was given funding to engage with community organizations to specifically focus on occupational health and safety. Many of those community organizations were addressing wage theft issues where people would do work and then they weren't getting paid, but the funder wanted and always had a very strong interest in worker health and safety. So I started through my network connecting with worker centers, and I found their work, one, like the title says, Untold. No one knew about this amazing work they're doing. I found the diversity of the organizations was super interesting. And I ran a blog at that time. A colleague and I were writing some blog posts about and it just morphed into the idea of a book. I actually had no interest in writing a book, but the funder, it was called the Public Welfare Foundation, they contacted the publisher, The New Press, who approached me about writing a book. And it seemed like such a daunting activity. And so then I was looking for a co-author. And I, at a conference, Jane was there speaking on a panel. I love reporters. I'm like enamored with them. And I just went up and asked her, I'm like, I don't know you, but how about we work on a book together? And that's how it happened.
Do you want to share your side of things, Jane?
That's exactly what happened, because I have a lot of friends who've written books. I mean, so many reporter types have, and for them, it's a huge hustle. Like they beg to get a publisher. They beg. They are so have to be so entrepreneurial in everything they do, and it's really really hard. And so none of my friends can believe that I got so lucky as to have the publisher in line and work with somebody already who had gotten started. So, and but plus besides that, it's an interesting topic, and I covered labor for all that time, and I always was particularly interested in health and safety on the job, and like to write those stories. Um, they were just interesting to me. So, and we learned a lot in doing it. So it was great to work with Celeste. She's the best.
And I would
Great.
say that, like as I said, it's like this untold story, but it was also a moment in time, at least in my view, that was very, there was just so much negativity about the world, our country, and all that. And at the same time, it was like I was bombarded with it. And at the same time, I would hear about these little pockets of positivity and action and people really caring for each other and trying to make their communities a better place. And I felt like, wow, more people need to know about this because it was just so heartwarming and important work. And so it's like, yeah, we should do this. We should capture this moment. As we write in the book, some of these organizations, some are strong, some are weak, some are going to are sustainable, others aren't. And so at least have a document that captures this moment in labor history and have it there for people. And the focus on health, I think, was the frame of public health.
Hmm. And a lot of that was written during COVID too, right? Because it was published in 2021.
Yes, it was published in 2021, and I think Jane and I met for the last time before things shut down. She was here at my house. We were finishing up the book. We sent it into the publisher, like said, here's the package. Then we don't know, like they're going to review it and how many edits you're going to get and all that. And the only comment they had coming back was, you need to have a preface or an introduction that talks about COVID, because at the time that we wrote it and submitted it, we didn't have that as part of the book. And there were certainly things going on at the Worker Center. So that's why the book starts out with COVID.
Yeah, that's interesting. So I know not everyone in our audience has read the book yet. Could you guys
What?
explain a little bit about the history of worker centers? Are they legal organizations or do they operate under the umbrella of any other organizations? How does that work?
I guess, when we think about even you going back to like Jane Addams and Hull House, there have always been organizations and communities, when Jane Addams and Alice Hamilton very much focused on immigrant communities, and immigrants come here to the US for those job opportunities. So, woven through their experiences, the work that they do. And so there's a long history of that. I can't say that I know of, this was the first worker center, because I think they evolved and some of them don't have worker center in their name. Um, and that was one of the things that, as Jane and I went and visited different worker centers, we did ask them, what's the history? How did this start? And there's a diversity of ways that they start. If you look at Arise Chicago, it started as a labor faith organization. This idea that the faith community has an important role in trying to lift up workers, provide, the whole social justice movement, and recognizing that labor rights follow along with Judeo-Christian views. And so it started as a labor and faith organization and then developed into interfaith worker justice. And then an offshoot of that was a worker center. So it was under that umbrella. And then interfaith worker justice started seeding worker centers in different parts of the country. So that's the story that I know with the history of some of the worker centers. Jane, in your reporting, Like I'm not sure about Western North Carolina. I mean, Western New York, Central New York Worker Center.
No, that was another one that was part of
Kind of
that group.
interesting.
I mean, a lot of them started in that way, but and had various, the ties were stronger or weaker depending on what was happening. But
Yeah.
I think a common sort of related question is, how do these relate to labor unions, and where do they fit in the labor movement? And the thing is, when you think about the labor movement, it's kind of a continuum. If you have two people talking about conditions at work, and then they want to complain about their boss or to their boss, that's a labor movement. And then you have on the other end, very organized labor unions with big staff groups, and sort of in the middle are these worker centers that form for various reasons. Sometimes, I mean, the New Labor in Jersey, in New Brunswick, New Jersey. They wanted to start out as a worker center, but it turned out the workers wanted to learn English. So so it started out as like a English as a second language organization, and then moved it more and more into worker center issues. So what one thing one thing that worker centers don't have is the ability to draw up a collective bargaining agreement with a business. So that's one thing. So they are more interested in policy and sort of moving society along. Maybe they'll do like one-off type of advocacy, like one group of workers in one business, but there's nothing set in stone like there would be with with a contract. So that's where they're different. And on the plus side for them, I mean, that's on kind of on the minus side, because what can happen is things can change as leaders in both the worker center and in the business change. But on the plus side is they're not bound by a lot of the same rules and regulations that labor unions are. Like you have to report every lunch you go on and all sorts of things like that unions have to do. But where you guys come in handy here is that labor unions have health and safety directors, often the big ones, and who keep an eye out on issues that affect their particular class of workers, whereas worker centers don't. And so, if that's where I mean, maybe you'll ask us more about that later, but that's some place that worker centers kind of need that expertise of health and safety professionals, because they have on the ground experience, but they may not know exactly what that means.
I would say that what at Street Level Health Project, which is in Oakland, California, it started out with physicians in San Francisco who wanted to do something for the community in Oakland, a lot of day laborers there. So they started a health clinic. But what they found was a lot of the day laborers, yes, they wanted, access to a doctor, but the doctors and the workers, when they started talking, they found that like a lot of the health problems were related to the work that they do, or that they don't have jobs, and the connection between not having stable work and how that affects people's health, with, whether it's with respect to like not having enough food, not having a safe place to sleep, all of those we call like, the social determinants of health. And so it really turned into more of a support organization for workers. And then they ended up with the Worker Collective, which is like a hiring hall. So that rather than having the day laborers wait in the Home Depot parking lot, they can register themselves at the worker center, and then whether it's homeowners or contractors call in and say, I need 2 workers to help paint the interior of the house. And there's a whole system organized so that the workers don't get taken advantage of, that they get paid and all that, but then also kind of a guarantee for whoever is hiring them that the worker center will stand behind the work, will make sure that these workers are going to show up, that they know how to do the work, and so on. So that was what was really interesting, is each of these worker centers was different. There are many that don't have hiring but there are some that do. It evolves from what the needs are in the community. They are run very much by input from the workers, decide what their priorities are. And that was one of my experiences with the worker center in Bryan, Texas, where most of the members are poultry workers. And of course, when I started to connect with them, I'm like, oh my gosh, they do all this repetitive motion. I'm sure they're interested in carpal tunnel and all that. And it was like, nope, they wanted access to the bathrooms. That was there. And for me, it's like, oh my God, like I'm up in the clouds thinking about like what I think is important. And then meeting with them and engaging with them and finding out that's where they are. And that's what's most important to them. And so it was such a great learning experience for me. But, each worker center is unique in their own way. And it's because of the members that they have.
And I mean, that really highlights the importance of, like, as public health practitioners, looking actually at the real needs, not what we think the needs are, right? Yeah.
Exactly.
So can you describe your approach to connecting with these worker centers? How did you learn about them, and how did you connect with them?
So I knew of some worker centers because I had been collaborating kind of on the periphery with some. I was involved with an amazing woman named Marta Ojeda, who's here in Texas, and she was a staff member of Interfaith Worker Justice. So I was providing technical assistance to a number of worker centers on health and safety topics. So I knew of some of the worker centers personally because I was doing some work with them. Then I knew of other worker centers like New Labor in New Jersey that Jane mentioned, and it's like a powerhouse worker center. I only knew of them and kind of admired their work. But they were one that I thought we really need to feature this worker center in the book. So kind of our thinking was, let's profile, and I think we profiled 12 worker centers, profile some small ones, profile some big ones, definitely look at worker centers that have members who are in different kind of jobs. So some are domestic workers, some are warehouse workers, some are poultry workers. And then also in different places in the country, because again, mine was kind of a stereotypical understanding of worker centers. You think them in New York City, Boston, California, and you don't think of them. Like there's a worker center in St. Cloud, Minnesota, Bryan, Texas, Sioux City, Iowa, and so it's like just learning about them in many different places. So we wanted to kind of give the full range of what these worker centers are.
Do you have anything you'd like to add to that, Jane?
No, I guess the diversity of the groups was interesting, but Celeste had all the contacts to begin with, and then we just divided them according to whose schedule was available and who was close to what, and went there, and each of them had such different stories. And like, for example, and even within the same industry, so you have the poultry plant workers in Bryan, and then also the ones in St. Cloud. In St. Cloud, the issue was that most of them were Muslim, and they wanted to be able to have prayer time. And so that wasn't a public health issue, but that was the issue that there was public health as well. I mean, there were big accidents with the machines. There was a guy, when I was there, a guy was badly hurt by one of the machines and was in the hospital. And I don't think that guy never quite completely recovered. And so those issues were still there, the health and safety, but you just never know what little wrinkle it's not a little wrinkle, what will be the dominant issue.
The other thing I think is important for public health, because we all do, we're very compassionate people who want to improve health and safety, and but making those connections, some of the worker centers I knew, And so I would call them up and say, we're working on this book. Would you be interested? And one of the things I learned was that, and some, I can't remember what executive director told me this, is, we are always hosting reporters, researchers, they all want to come in here and do surveys and interview people, but we don't get anything out of it. All it does for us is it takes like a day of our time when we're already overstretched. Some member is, going to get deported, and some worker just got injured and all that. So one, it was always something that they viewed as a benefit to them. And we would make a commitment to help fulfill their needs in whatever way. So like some of the worker centers thought that having a book about worker centers where they're featured would help them with major donors, to be able to go to the Robert Wood Johnson Foundation. And then others said, yes, you're welcome to come here. Our members are happy to talk with you. But can you provide some funding so when they meet, we can have that meal? When you interview them, that you can provide, a $50 gift card for their time. So we really relied on them to tell us, what they wanted. And then there were other worker centers that said, thanks for contacting us, but, we're not interested. And that was fine too, because we definitely wanted to go to places where we were going to feel welcome and learn from them, because neither Jane or I speak very much Spanish. So, it was also this thing where when we would go there, they were going to have someone, a member or staff member or someone from providing that translation. And so, it is a burden on them.
Yeah, that's a good point. So you touched on it a little bit. You talked about the different needs that each worker center had, but can you get into a little bit more of the kinds of campaigns or initiatives that you wrote about, that the workers are involved in, and any that you know about now that are ongoing?
Jane, why don't you talk about the dairy workers?
Right. So the dairy workers were super interesting. Just hearkening way back to sort of the Civil War era, agricultural workers, because most in the South, most of them were enslaved, were not covered. When the Fair Labor Standards Act came on, which guarantees minimum wage, they weren't covered. So the health and safety, one of the main, besides health and safety, one of the main campaigns was just to merely get them covered by that law. In terms of health and safety, oh my God, you don't, like, I'm a city girl, right? So I know nothing about cows except I see them in fields, and I drink some of their products. But anyway, they it can be very dangerous to be near cows. They kick. There's injuries where people slip in the kind of manure piles that are around. It was interesting to learn that just on a health and safety issue, that in some smaller farms where there were fewer workers, people would be on 8-hour rotations. So they never got even full 8 hours of sleep between milkings of cow milkings. So those were some of the health and safety issues that came up. People were kicked by the cows and hurt. And so, and then of course there was the usual, like, migrant agricultural worker living conditions, substandard living conditions and all that. So those, the biggest triumph of this group was to get the New York State Legislature to agree to cover them under the Fair Labor Standards Act. And they did that also by putting pressure not only on the farmers, but also on the buyers of the dairy products, specifically Chobani Yogurt Company. And so that was really interesting. And we traveled, my husband and I traveled all across the state of New York, going to like some party to raise money for a worker that had been rounded up by the immigration services. And upstate New York is, you forget, it's right near the border. We think of New York, we think of New York City, but my goodness, it's not far, and the border patrol people come into the state quite a bit, and the dairy and many of the dairy workers were full of Mexicans and of uncertain status, so they were vulnerable. So those were some of the issues that we found in covering the dairy workers. What am I missing, Celeste?
Well, I would say the temp workers, and this was really interesting because I would say it was Mascosh in Boston that was the first to work on a national campaign. They were very, very integral in that to get a temp worker bill of rights. So these would be, individuals who get hired by staffing agencies. And at that time, when they were working on the campaign, you'd get hired by a staffing agency and you'd just be, they take you somewhere. You didn't even know what kind of work you're going to be doing. You didn't know what kind of PPE you might need. You may not have training for the job. Some of them would take you to the job. So there was a van. So then they would take money out of what you were getting paid to pay for transportation. Like many, many abuses of these workers being injured or killed on the job, and the host company and the staffing agency disagreeing on who's going to cover, who's responsible for workers' comp. So people caught in this bad employment situation. So Mascosh worked, had a lot of temp workers that were involved in a campaign, and eventually the state passed a law, the Temp Worker Bill of Rights. And it had, when you work for a staffing agency, you have the right to know who your host employer is, who the, the place you're going to be, the kind of job, all of those types of things. So after that was passed in Massachusetts, I think it was then Illinois that said, wow, that's a great victory. Let's do something like that here. So they took the Massachusetts model and then they added to it. And they said, well, let's also have this in a Bill of Rights and that in a Bill of Rights. And then I think New Jersey was the next one. And these were all, their worker centers were very much, and perhaps even at the heart of those campaigns. So that was another good example. Similar, the situation with domestic workers who, people go, they're either housekeepers or nannies or home care workers, very isolating work. You don't have coworkers and all that. So abuses in that way as well. And very similar, even in more states have adopted a domestic worker bill of rights. And I think that, one of the many things I learned was these campaigns are important because it brings workers together to make a change. But it's never just about the change and accomplishing that, which is a great success, but it's building a community of people who can see, we have common problems. We can identify solutions, and then we can push for them. And even if we are immigrants, we don't speak the language, we may not be authorized to be here in the US, but with this community approach, we can make change. And it's about the struggle. So even when you get, Jane knows this very well, once you have that success and you have like a temp worker bill of rights, it's not enough to just have it. It has to be enforced. So we saw,
and that's the new front. I mean, when we were finishing our book, that's the new frontier. The new frontier is enforcement. So it's really in a way, like when I hear the phrase Bill of Rights, it's a little bit of an eye roll for me. Like, okay, great, you got a Bill of Rights. Now what? If you don't have a department in the district attorney's office or in the mayor's office or somewhere with investigators and lawyers, then you need that. And so the big push of these worker organizations came to be after a while, after they got their first triumph, was to push for this. And Arise Chicago was really big in that. And actually now I met a guy just a few weeks ago here in Philly, and our DA's office just assigned one lawyer and an investigator. It's not enough. But it's a good way to begin to get these. And the other thing we should talk about is on the health and safety, from the health and safety point of view, is that when if you have an employer that's no good, like on the wage side, chances are they're no good on a bunch of other ways as well. And so one thing these worker center people are and organizers are good at is when they meet a group of people, they start questioning about the whole package. And so they'll find that this group has been short at their pay, and this group is working with a machine that's broken. And some other place there's a leak, and the general like combination of miserable circumstances brings all these workers together, and by doing that they get enough numbers where they can make a difference, and they have different levers that they can use. So maybe they're not getting anywhere on the wage side, but maybe they can get somewhere with an OSHA complaint. I mean, employers are so afraid of OSHA, even though OSHA has very little teeth, even though you'll probably never be inspected by OSHA in a lifetime. But even though all those even those, just the fact that maybe these workers are going to complain to OSHA might be enough. So it's like that was what was kind of interesting when you look at the actual strategy for how things are done. That one of the strategies is to use health and safety, a laudable goal on its own, of course, but as a lever to help many aspects of whatever the problems are.
Absolutely. That makes so much sense.
I wonder if any of the participants have any,
Yeah.
you know, one of the things, we can talk forever about this, but I'm wondering for those who read the book, you know, which worker centers sound like most interesting, or like what struck them about, we had so many cast of characters in the book and so many like amazing, it's almost like we couldn't, because there's so many voices and so many quotes, it's like you couldn't write this. I mean, the stories wrote themselves. I mean,
Oh, I don't know about that, Celeste. I think that's a little bit of an exaggeration.
I don't mean the stories wrote
I'm
themselves.
just kidding.
The stories were there.
Yeah, that's
It
true.
was just we were the conduit to get them on paper. But I think about some of the things that I heard from Marta Ojeda. I mean, it's like, you like thank God for an audio recorder, because I never could have written down the amazing things, that she said, that just, just in such a concise way, uh, captured, what we wanted to communicate in the book. So I'd like to know if any of the participants have questions or comments, whether or not they read the book.
Well, we do have a question. We do have a question in the chat, actually, from Kirk Shamley, who says, so many people will complain of immigrants, both legal and non-documented, not being able to speak English. In the book, immigrants commonly expressed a primary need and desire to have access to learning English. Interesting situation. Do you have further thoughts?
I guess, it was the new labor story is the one that just comes to mind because it's actually really funny. There were these young kind of lefty college types at Rutgers, and they really wanted to have a worker revolution, and and then they even got the guy that's Lou Kimmel, who's now the head of it. They even hired him as a young man to just go and be on these like go out with these temp workers as do whatever they were doing. He was like a plant, and they kept quizzing him. Oh please, let us let us find some kind of revolution. And he kept saying, no, all they want is English lessons. So I think the lesson is meet the workers where they are and do that. And not all of them were looking at that. Only a handful that we came across had. Celeste, do you remember any others, or was it just New Labor that were doing English lessons?
I think up in St. Cloud, we don't talk about it in the book, but I think that in St. Cloud with the Somali workers, I think Ahmed was doing some language, English language training. But again, it's what the people in the community want. And maybe it's they can get those resources at other, from other groups. One thing that I found at the worker centers is much of their work takes place in the native language, but also, signage, training materials, and all that is often bilingual. So, there are efforts to do that. And, my Spanish is a lot worse than native. The people I encountered who are Spanish speakers, they knew a lot more English, than the Spanish I know, because they live in an English speaking country. And so, to get by, and also to the extent that they have children who, are in school, they're learning English in school, or that's their primary language, and they can help, their parents with that.
Yeah, so I just want to remind everyone, if you have any questions, you can pop them in the chat. I'm going to ask you guys, what's next for you? Is there another book in the future for either of you?
I don't think so.
No.
Well, this was a luxury trip. I mean, how can you go from a 5-star experience to just having to like really have so much effort? I mean, my friends who are doing this, they work so hard, and this was just such a beautiful thing. I mean, I wish we could do the same thing or do a related thing again, Celeste, but I don't think the opportunity is lining up in the
Yeah.
same way.
I would love to work on another book with Jane, because it was such a great experience. We're very different in, she is,
I'm much better looking.
she's an amazing writer. Her life's work, she started like working on a newspaper when she was in grade school. I mean, she is a writer. She's, reporters are known for having those deadlines. I'm someone that just, angst over every word. It takes me so long. So I learned some of that from Jane, of how to do that. But we had a really great working relationship.
True.
She brought lots. I had, things, I had the contacts and had the health and safety background. So it was a great experience. I wish we could think of another way to do that, but it's a lot of work.
Really
It's
is.
a lot of work. And then we didn't even have the struggle of, finding a publisher. I mean, I hear colleagues contact me and they're like, "Oh, I'm working on a book and all that. How'd you get your book published?" And I'm like, our experience was so different, because people do write books, but then they try to pitch them to a publisher and get a publisher interested. And that's really hard. As Jane said, she has skilled colleagues who are writers, and then you're like groveling, trying to get them to even read like a first chapter. And our situation was extremely unique.
Wonderful.
You know,
But, oh, Carly, are you going to ask us? Because there's something I think we should really talk about, which is the role of public health people in this a little bit more.
That's great. Let's ask that question.
Go ahead, Carly, do it.
So
Then I
what
won't
is
feel.
the role of public health as it relates to everything we're talking about today?
Well, I would like to answer that question. No, one thing I think we found that a lot of linkages between academics and these groups. So, for example, the Syracuse group had a professor, Gretchen Purser, who was involved, and the thing I think the public health professionals can bring is researchability. I'm gonna talk about very broadly first. Researchability, language skills, like how to even if it's not your field, how to look up studies, how to how to understand if these clean chemicals are being used for rinsing off a chicken. What are they? What do they do? What are their effects? Because this is expertise that the worker centers do not have. In Chicago, they even developed these green cleaning methods of to wash down, wash your floors and toilets with stuff that's actually not harmful to the environment. It was a good sales pitch for the domestic workers who were involved. So expertise along those lines. Also, I don't know if the quite a few, the one in Syracuse, there were some Filipino workers out on the West Coast, domestic workers. they do different types of workers would do surveys, and these surveys were qualitative and quantitative. And so with, margin of error and a description of research methods. And this is something that people can bring. Even if it's not your field, you probably do know how to set up a study, how to supervise a study, and all that kind of stuff. And what happens is like if you survey like the dairy workers, and you do a really good survey, then that survey with all its footnotes, I mean, footnotes are fabulous, and all that, credentials, that becomes a way in for people to for like reporters and public officials to fully understand the problem. So I don't think public health people like all of you folks listening in should feel like there's nothing you can do, because even you can be involved by just with your academic and skills that you have. So it's really important. And then not only that, but then you all, I mean, it's a terrible thing in our society that people don't have legitimacy just by virtue of the work they do. But at the same point, it's handy to have somebody explain things. Like, things are outside of our experience, working in a chicken plant, working in a dairy farm, working in a clothing factory, working as a temp worker, cleaning out bogs or whatever different jobs that people have. Those are outside of our experience. So to have someone be a translator, it's valuable. It's a valuable thing, and sets you up with funders and politicians and all that, and reporters.
It's one of those things where we as public health people, we understand the science, as Jane said, the research. We can read complex studies or, information sheets from agencies. And we have the ability to take that information and put it in plain language. And that's something that is really valuable. And Jane said, footnotes. So that's, if they're putting together a letter to the local health department or to OSHA, and they're describing, here are the hazards we're facing. And, I or another public health person can then put those footnotes in there. So it gives that legitimacy that, yes, this organization, they really do know what they're talking about. So that's of value. There was an example during COVID, and it was like that first year of COVID, and at the poultry plants around the country, meatpacking plants throughout the country. And then it was very frightening for the workers. I would hear workers on the phone. We were doing like weekly call-ins. They were scared to death about going to work and getting COVID. Not getting COVID for themselves to get sick, but that they were going to bring it home to their families. That's what they were so afraid of. And there were some terrible things going on here in Texas with the National Guard and all these things going on. Anyway, the local health department had received instructions from the National Guard that they were going to be doing COVID testings and temperature checks at this local poultry plant. The National Guard was there, so they were in these like camo trucks and camo outfits. And so workers were not even, they drive past their workplace and like drive right back home. They'd rather not go to work, because it looked like, immigration as far as they knew. So there was a real disconnect between the workers' reality in their town and kind of this public health approach from the local health department. I think it was the county health department. So they would share this with me, and I'm always Celeste on the call. I use my title doctor for convenience. So they would say, can you call the local health department and say you're Dr. Monforton, because we think they will listen to you more. And I would, my response was, this is something that, we should think about whether that's the right approach. But they were insistent, you know, that they wanted the doctor to talk to the health department, and it actually worked out pretty well. But you know, it's using those credentials for the good, not for kind of the ego. But in some ways, those letters after your name, including your very special certifications in public health, I think that alone can be of real value. Right now with the avian flu, because of the book, I was connected with a worker organization in Vermont with dairy workers. And you know, a lot of these small organizations, worker centers and others, they're always looking for people to be on their boards of directors. Like, it's a volunteer task, it's not a lot of work, but you know, there's some things you need to do, but it's another service to the community. And I always learn a lot about, you know, what's going on in different places by serving on boards. And with avian flu, you know, these dairy workers are really concerned, and the farmers are concerned. There haven't been any cases yet in Vermont, but you know, certainly I think there's at least 8 or 10 states where avian flu is now been identified in herds of cows. And so, you know, one little service I'm doing, and I don't know if this is your, you know, other people on the call, your experience, you know, every few days I'm getting something over my email or in a listserv about avian flu, CIDRAP reports and what CDC is doing and some new funding from USDA and so on and so forth. And this organization up in Vermont, the executive director, you know, they're really busy. It's a small organization. Of course, she knows this is going on. She's concerned, but it's basically, there's so much information. And so she said, Celeste, can you look at that when this new stuff comes out? Can you kind of cull it for me and maybe let me know, put a few bullets together about like the latest information, send that off to me. And then if I want more, explanation, she said that would be a huge help to our organization. And so it's a really small thing, but it's something that all of us in public health feel competent doing. I mean, I'm not an expert in avian flu, but let's face it, I know more about it than they do. And I know where to go for correct information now I'm learning about it, and then I can put it in plain language and share it with them, because they're the workers they deal with, the workers that they have a hotline, are calling about it because they know that something's going on and they're afraid. And the more information we can provide, can help them ease their fears, or let them know, like, this is what's coming down the road in terms of protections that we will need to see are put in place.
Yeah. You're getting at one of my favorite aspects of public health, which is like bridging that very cerebral, academic language world with, let's actually help the common people. Mm-hmm. And you can't do that if you stay in that heady intellectual space. You have to be able to translate it to the people that you're actually trying to serve. And so I love like how you're describing, taking these like complex concepts and putting it into easy to digest language. You're not dumbing it down, but like you're just making it more quickly understandable. And I think that's a very key component of public health practice.
Yeah. And but listen, it goes both ways. Yeah. Right. That's a key point, because while you are doing that, and it's a fantastic service, just remember the story that Celeste told about the bathrooms, you need to also be paying attention to what is needed. And that's a great example that Celeste gave with the Vermont dairy people.
Yeah. And Carly, you make an excellent point. I mean, that translating the knowledge to them. And even if I look at like what CDC has on their website, like their latest update, it doesn't look like a lot. Like you or I would look at it and it's like, it's a web page, and maybe if I printed it out, it'd be 2 pages. But still, for that organization, it's a lot to think about doing that. Like, what is the most important thing? And so I pointed out to her, there's a really cool map. And right now it highlights the states where the avian flu has been found, in either wastewater facilities or in the herds themselves. And it's like, oh, it's something they can visualize, but that saves her a step to like go and look at it herself and like read the whole thing. And so it's so simple, something really simple to do.
And Jane, what you're saying, sending it back as well, I think is fantastic too, because it's at fault when that doesn't happen is the same, almost like, I would call it like the intellectual ego of like a public health practitioner who's like, well, I'll tell you that you need whatever, what was it that you said, Celeste? Instead of bathrooms, you were like, oh yeah, like ergonomics, right? Which
Right.
of course makes sense, but like, they're like, I would like a bathroom.
I mean, and those were heartbreaking tales of people how first of all, you have to get in and out of your gear when you go to the bathroom, and then the bathroom that's closest to you is broken, and it's like a 10-minute walk across the factory floor. That was really interesting. But there's this is my little lecture that I like to give in these talks, which because we're college educated, we're professionals, and we may think that people that dairy workers, poultry workers, are very different from us. But there's one issue that unites all of us, and I call it line speed. And one of the problems they had ergonomically is, how often they're pulling their chickens down or cutting things off and all that. But the faster the line moves, the more likely there is to have injury. Now, where does that fit in with professionals? Imagine you're a caseworker you're having to deal with children in the foster care system. And I know no one has paper files anymore. I'm being metaphorical here, but you have a stack this high on your desk. That's the same as line speed. There's no way you can get through those. And when some child is killed at a foster home, where what word I'm thinking of here begins with an S. When that hits the fan, this line, you're going to be that bureaucrat person is going to be blamed, that social worker. How about a nurse? A nurse, when she should have 8 patients, it has 10. How about a teacher, where she should have 25 in a class, she has 30. These issues are this is the same exact issue. So it's really important that people see themselves as similar, as united in this way. And that also helps with this, the thing that you were describing, Carly. Sorry about the hands. I'm going to sit on them. As that Carly was saying, that, that where you may be isolated in that intellectual area. But if you think about this line speed issue, you'll see how so many workers, whatever their educational and professional status, have in common.
Capitalism is capitalism, no matter what the flavor.
The stress effects of work, both, as Jane was saying, the pace of work and not being able to keep up, but other things, juggling family responsibilities, all of those things create stress. And we didn't address it specifically in our book, but absolutely a public health topic: burnout, mental health.
We did address that among the leaders of the organization. Right. The organization's leaders really suffered from burnout. And a lot of them turned over even in the period of time.
So those public health issues as well.
Yep.
Any more questions from the audience?
Yeah, do we have any more questions from our audience? I don't see any in the Q&A. And I know we're closing in on an hour, so I'm probably gonna try to wrap us up unless I see any.
I'm wondering if anyone would share like what the oddest or hardest job they ever had.
Oh,
I've often done this with other book clubs, and like the jobs people have had are super interesting and very different. Anyone want to share?
Just pop it in the Q&A if you do feel like sharing. This is not the strangest job. This is very benign, but I will just share that, as a teenager, working in Subway, And then like getting my first like professional job out of college, it was like the amount of work that goes into being a retail employee, like being asked to like constantly be on your feet, constantly be moving, don't waste any of our time, and you're getting paid minimum wage, is just such a crazy dichotomy to like my current job where I sit at home and I work on a computer and I make so much more money per hour. You know, it's just this strange, you know, strange dichotomy of like how does that happen in society? Because I would frankly much rather be doing this, even if the pay were the same.
My students call it retail hell. And you know, one of them will say retail hell, and they'll be so you know, whether they work at Target or the grocery store or whatever, they just nod their heads, and there's so much more monitoring.
Yes.
Kind of work. I've heard from my students who, when they're cashiers, but now also those like shoppers where people put in their orders and then you know, they pack up the bags and all that for people to pick them up. Like they're timed for that. I'm like, oh my gosh,
right.
That's like really stressful.
Yeah.
I can't imagine that.
Yeah. And you're right. Like the level of independence and like kind of autonomy in some of these higher wage jobs is like even psychologically a totally different experience than having to work, you know, in a retail.
Yeah.
All right, well, I don't see any other questions or responses. So I'm just gonna thank you both so much for your time, for sharing, you know, the behind the scenes of writing your book, and, you know, the things that we didn't even get to read in the book, the stories that there probably weren't space for. So it was so great to hear that. It's fantastic to have you guys here. Thank you guys for your time. And thank you to the audience for showing up and listening, and looking forward to reading your book and chatting about it in the Goodreads book club online in a couple of weeks.
Okay, awesome. Thank you so much for inviting us.
you.
Really appreciate it.
Yeah, that was great. Thank you.
Okay, bye.
Thanks, guys.
Bye-bye.